is Laura Olkeby. I was diagnosed with pelvic congestion syndrome in June of 2022. And in this video, I'm going to tell you about the symptoms that I had and when they first appeared, and to see if this helps you as you're trying to figure out, do you have pelvic congestion syndrome or not? But I had my son in May of 2017, and it was a pretty easy pregnancy other than feeling horribly sick in the first trimester. I was able to stay active. I coached spinning classes until 35 weeks pregnant, had a really good delivery. And then, for probably 10 months, I didn't feel great, but I just associated it with, being tired and a new mom. And around 10 months old, we moved across the country. I started working out more, and I was noticing that my legs were really tingly, especially after my spin classes. And I thought that maybe it was the saddle on the seat. Maybe I had incorrectly heightened my, seat on the bike. It was a newer gym for me. Maybe I need new spin shoes. Like I went to REI and spent $100 on new spin shoes, but it was so prevalent, like this tingling and numbness in my legs. At the same time, I was also dealing with something I thought was unrelated, just this really intense fatigue. I still remember being on a call with a boss at the time, and they're telling me something, and I'm just completely zoned out. I cannot pay attention to what they're saying. And it was really just this intense fatigue that would wash over me. And I, of course, had some back pain. And I would feel it most when I would be bending over in the car to get my son in and out of the car seat. I couldn't breathe. Like if it was more than 10 seconds, like I was doubled over in pain. So these things were happening, and I went to see a primary care doctor, and she looked me in my eyes after I read her off these symptoms, and she said, "Could you be depressed? Have you been anxious?" So immediately she's thinking like, you're crazy. She does send me to a neurologist. We do an MRI, we do blood work. We see if I have arthritis or Lyme disease, taking a look at everything, and everything comes back clean. No issues with your blood work, nothing seeing in the images. Like, I don't know what to tell you. And so you think you're crazy. And you kind of just move on with life too. Like eventually the fatigue, it comes and goes. The pain, it comes, it goes. The tingling comes and goes, and you just move on with life. And it was after the birth of my daughter in March of 2020 that the symptoms reappeared and really kind of amped up. And so if you remember, March of 2020, there were some things going on in the world. We had our daughter, then we were in lockdown, and I really wasn't mobile, right? I wasn't moving. I was so anxious about what was going on. I have a newborn. And so I thought that the pain that I started experiencing was related to the fact that I had been sedentary and in our apartment, and that I had been really stressed. And so the symptoms that really kind of amped up again were the fatigue, right? This is like bone crushing fatigue. It was just like from the moment I would wake up, I just felt horrible, even with a good night's sleep, horrible. I also had this really intense back pain, really particularly on my lower left, like on the lower back on the left-hand side. I could just like put my finger on it. It's like, this is exactly where the pain feels, as well as lower in my left, like pelvic area. I could also just like put my thumb on it and be like, this is really painful right here. So I had this very like targeted specific pain in my lower back, my lower pelvis. I was really fatigued. I wasn't noticing the leg tingling as much at the time. But I went and saw my gynecologist, and she said, you should try yoga. You seem really anxious. I went to a physical therapist and thought maybe we strengthen my pelvic floor. And she did do some cupping, and we did some weight exercises. And I'll say that the cupping did help with the lower pelvic pain for maybe like a month or so. And she said she could feel some like inflammation there. But I really just wasn't feeling any better. And it became then, this is when it started to affect me mentally. So you feel so bad physically, you're so exhausted, you can't work out. If I would try to work out, I was in a lot of pain. I would get really intense pelvic pain and back pain if I would run or try to cycle. And so then you just felt like you're on a hamster wheel where you're like, I can't get better. I would typically just be exercising my way out of this funk, and I can't. And I'm so tired. I'm so tired. And this went on for years. until I had a critical event where I woke up one morning in June of 2022. So gosh, this is literally 2 years have gone by, and I had a stomach pain. It felt like something gastro related, like maybe I had a tummy bug. Like so many bugs had been going on through the school with the kids. But I wake up and I'm not feeling great, but I just figure I'll, see how the day goes. The pain gets worse. It feels very similar to a labor pain or what I've experienced possibly before. It was described as like a kidney stone. And so it's coming in waves. I'm doubled over. I'm so nauseous. I eventually get myself to an urgent care, and they say, we don't think you have anything going on with your appendix or anything with your spleen. Maybe it's flu related. Maybe it's food poisoning. Here's some medicine to deal with your symptoms of pain and nausea. And if you continue to have pain over the next week or so, then take yourself to an emergency room. And so I did take the medicine. It did help with the symptoms, but I had this lingering, dull pain right in my lower, left of my belly button. And so I went to the emergency room a week later outside Cincinnati, Ohio. And I said, this is the deal. A week ago, I was in urgent care. I could not walk. I was doubled over in pain. They said, go to emergency room and figure it out. And so here I am. And they were fantastic. And they ran every test. They ran blood work. They did a CAT scan. They did an ultrasound externally and internally. They looked for everything. And eventually they said, we just see a slight inflammation in your pelvic area. And so we think it could be pelvic congestion syndrome. And that was the first time I had heard this word. And when I asked more information, they're like, we don't really know a lot about it. So it's kind of phenomenal now to look back. It's like, how did they even know this term? If they didn't know much about it, but for them to say we think it could be it. And then she referred me to a gynecologist. So I'll talk more about what the process was and how did it go next. But now that I know, now that I've been diagnosed and I look back on the symptoms, here's what was happening. So the leg tingling, this was a symptom of my varicose veins, right? So women who are pregnant often get varicose veins. And it's because our blood veins widen to allow for more blood to support us and our baby. And so after pregnancy, if they don't go back to normal size, they stay varicosed. And so my legs were starting to varicose after the birth of my son in 2017, but they weren't visible yet. So when I would feel this pain, when I'd feel this numbness, this tingling, and I'd look down at my legs, especially after long distance flights, I still remember I would be like, what is going on with my leg veins? I feel like they're bulging out of my skin. And I'd look and there was nothing there. They were already varicosed, but doctors couldn't see. And I was so young, it didn't make sense. So the tingling in my legs that I started having in 2017 was varicose veins. As well as the fatigue, I've also learned since from my doctor that this, again, all has to do with the oxygen that's in your blood, that the blood is getting congested in your body. And so it's just not working at an optimal way. And so definitely by the end of the day, you hear a lot of patients with pelvic congestion syndrome say, we are exhausted. We literally can't be on our feet anymore. We have to lay down. It's this bone, to the bone fatigue. That is because of pelvic congestion syndrome. And then the pain as well. We'll talk more about this in future videos, but guess what? Where I had this very centralized back pain in the left lower back as well as the pelvic, that's exactly where I have veins that were just congested with so much blood and pressing up against organs and nerves and causing this pain. It's literally congested blood. And so looking back, when I was telling my symptoms to doctors and they said, none of this is related and everything looks fine, all of these symptoms were because of pelvic congestion syndrome. So if you're feeling like any of this is familiar to you, fatigue, tingling in your legs, lower back pain, pelvic pain, a lot of pain centralized on the left-hand side of your body, and you've had multiple pregnancies, you don't have to have had pregnancies, but this is very common in women who have had more than one pregnancy. You very well could have pelvic congestion syndrome. So that's just a little bit about the symptoms that I had. I hope this helps as you navigate and take a look at some more of my videos in my resource, pelviccongestionrelief.com, so you can navigate your path to relief faster.